Okay, welcome to Roadmap, Autotrader UK's product and tech podcast, and we're going with a total tone shift today. We're going to be chatting to Tim and Richard about prostate cancer from both a personal experience and medical perspective. So welcome both.
Hello.
Appreciate you both coming all the way here to chat about it. So first of all, Tim, do you want to just quickly introduce yourself so everyone knows who you are?
My name's Tim Woodman. I'm one of the medical directors with Bupa, actually. I'm a GP by background,
Right.
but I've spent the past 10 years working mainly in cancer. Prostate cancer is a particular interest of mine, so really happy to be here.
Right, great. And Richard, you're an Autotrader colleague, so do you want to give a quick intro into you?
So I'm Richard Penrith, work on non-car new business, or BLC new business, sorry, I should say. And I've had experience of prostate cancer in the last 12 to 18 months, so trying to raise awareness and hopefully open people's eyes to it.
Yeah, no, defo. So to start off, Tim, I mean, like, just from a medical perspective, what are the sort of stats? Because I do see like flyers or stickers in motorway service stations, toilets, etc. But if you press me, I'd be like, actually, I've got no idea. Probably should, but I haven't.
Okay, so prostate cancer now is the commonest cancer in men. It's just about the commonest cancer being diagnosed in the UK at the moment. There's about 12,000 new cases every year.
Yeah.
And it can affect men more or less at any age from 40 onwards. It's much more common as men get older, very, very common in the kind of 70s and 80-year-olds. It more affects men who've got a strong family history. If you've got a father or a brother that's had prostate cancer, you're more likely to get it. If you're black ethnicity, you're twice as likely to get it. You've got a 1 in 8 chance anyway. So those things start to increase. Strangely, if you're of Asian ethnic background, you're less likely to get it.
Right.
And we don't know why. There's obviously something genetic in there, but it's become a very common cancer. It's becoming people are much more aware of it now through the media. I think what's important is that people don't really understand what the prostate gland is and what it does.
Yeah.
And it's a little thing. It's about the size of a walnut. It sits right underneath your bladder. And its main function is to produce the fluid that transports the semen when you try to have a baby, basically. Prostate cancer develops in the prostate gland, sometimes only about the size of a pea. So there's this tiny little thing that has a massive impact. And because of where the prostate gland is, that's why it causes some of the symptoms, which we can come on to later on if you like.
Yeah. Yeah, I am, like, it's a bit, I don't know. It's a bit worrying when you talk about it, because I'm thinking, well, I'm in my late 40s.
Mm-hmm.
I think my dad is in his late 70s. He's been recently diagnosed. And it's a bit where I'm going, I've thought about it, but I've not thought about it. Like,
there's also a trend for people who like cycling as well. It can be common in because of where the saddle sits as well. So you are ticking a good few boxes.
This is one where, like, this is where you get diagnosed on the couch. Oh my God.
Yeah.
So, Richard, I mean, like, I know, obviously going into your personal experiences, but like, I know you're in remission now, but when Tim was talking, did you ever consider that you could get it?
So how it started for me and my kind of journey, if you want to call it that, it was, I'm probably similar age to you. I was approaching my 50s, so late 40s, and I'm thinking I need to start doing some tests here and checking that I'm okay. Obviously feeling fit and well, no symptoms at all. I started asking my GP, and I had some checks done on my heart. That all come back fine. And then I asked, could I have my bloods done for my prostate? Just completely rebuffed. They said, no, you don't need it. You're too young.
Right.
You need to come back in like your 50s, come back in 10 years' time.
Yeah.
And I took the hump with my GP and put the phone down. And it was only, I think, because I did that, she rang me back and said, look, if you absolutely insist, we can do it. So after the blood test come back slightly high, they did it a few times and then referred me to urology. On the back of some additional testing, MRI, biopsies, I think it was a week before my birthday, I was like diagnosed with cancer, and it was really weird because no symptoms at all. Went in expecting to be just told it was inflamed or it was an infection, walked out with a Macmillan pack under my arm, and it was completely shocked. And even now, it still hasn't properly sunk in about the fact that I've had it and it's been treated. And
So how long ago was that?
this was last March.
Right.
Luckily, because of where I am, I was quite near the urology centre for Manchester. I was in and operated on by June, and then a couple of months rehab. I was probably back in work by about September.
But it is that bit. I mean, like, I remember, I don't know, I had this assumption that when you got to 40, like, you got booked in and you had like a full MOT and stuff. And I remember like going into the GP and I got like some blood test weight, and they said, yeah, your bloods are all right. You know, there's some stuff that you need to like lose a little bit of weight. Not too bad. Cut down a little bit on drinking, like the usual. But I thought, well, don't you do a prostate check?
No.
But like, it wasn't until we started talking, going like, and you had to push for it.
Yeah.
Because I was thinking, did they just miss me, or is it something that now, like, the standard is that when you get in your 50s, you start having the check? So is that something that, is that always been the way, Tim, that it is people start the mandatory testing is?
It's always been the case. It's not mandatory at all. I mean,
recommended.
It's recommended. Yeah, I mean, and that's the first thing, is there is no screening program for prostate cancer at the moment. And the blood test, the PSA test, that's an enzyme that your prostate gland produces normally anyway. There's always a little bit going around.
Right.
Anything that upsets your prostate, the level can go up. Now, the reason for putting the cutoff in at 50 is younger men are more likely to get infections, a bit of inflammation anyway. Older men, it's more likely to be prostate cancer. So that was literally, I just kind of put a knife down on it.
Right.
The trouble with the PSA is it's rubbish, not to put too fine a point on it.
Yeah.
You can have prostate cancer and have a normal PSA, and anything between 30 and 50% of men with a high PSA will not have prostate cancer anyway. So you can find yourself with a moderately raised PSA, rather like you had, going through all of these other tests and then being told that they actually haven't got prostate cancer. And what people like to know really is, I haven't got it. They don't want to know I have got it.
No.
So
No. It's a bit like, when you said about having the heart checks. I remember I had some stuff done, and you're just wanting the no answer. Like, I don't know what it'd be. Must have been absolutely shocked to get a yes answer.
Yeah, and it's just an indicator, isn't it? The PSA. It's not hard and fast. It's an indicator that might give an indication towards it. Yeah, I think one of the big misconceptions is to be crude, the old finger up the bum test. I think a lot of men stick their head in the sand and they think it's not going to be me because they don't want to go through that. But I think it needs putting out there that is an old-fashioned test, and that again is only an indicator. It's not necessarily part of the assessment process. So if you ask your GP, it doesn't necessarily mean they're going to do that at that stage.
Yeah. It's funny because it sounds like stupid. Like, I think I'm relatively well educated and sort of know me stuff. I assumed that was the test.
Mm-hmm. It used to be. Again, it's horribly inaccurate. A lot of doctors don't feel an awful lot of normal prostate glands. So to be brutally frank, they may not know what they're feeling for. Yeah. By the time there's anything really obvious and not normal, your cancer is so far advanced anyway. Yeah. So it's a rubbish test again.
Yeah.
Yeah, the kind of feeling for abnormalities aren't really up there, but if by the time it's that abnormal that they can feel it, it's normally got to the stage where it's too late or it needs serious treatment.
So are there any early signs? So again, you talked about risk profiles based on ethnicity and like age and family history and cyclists. I mean, hopefully, because I'm a mountain biker and not a road cyclist, so cycles, the seat's not up my bum most of the time. I'm all right, but you know what I mean? One of four variables out of the way. Are there any like symptoms that if I'm sat here on the couch like sweating a little bit, is that I should be going? If you're experiencing these things, those are definite signs to go and get checked out, or is it just like do it because you should do it?
No, there are symptoms. Again, it's a confusing area because a lot of these symptoms may have nothing to do with prostate cancer. Yeah. The commonest symptom is getting up at night more often to pee. Now, the assumption is as you get older, your prostate gland does grow anyway. Exerts a bit of pressure on your bladder, means you're more likely to get up for a pee. If you've had 6 pints and you get up 4 times, don't worry about it. But if you've had a normal fluid intake and you start realising, I was up 3 times last night, and that's happening every night,
Yeah.
and you're relatively young, that's worth getting checked out.
Right.
If you find when you're going for a pee, you suddenly can't pee halfway up the wall anymore, the stream's got less, your prostate gland squeezes the outlet from the bladder, that's worth getting checked out. If you get anything like, if you get blood in your urine, if you get blood in your semen, all of those things are symptoms that need checking out. But as you said, Richard, and as we know from people like Chris Hoy, you can have no symptoms at all sometimes as well. So that's another reason why prostate cancer is a little bit of a so-and-so to deal with.
Yeah. It is, the more you think about it. Because like us, when we talked before, and like one of the dads in me eldest football team, he was really poorly with it and was off work for a couple of years and stuff. And then, he's good now. But it's a bit even like when he was telling us on the touchline, he's like, I think everyone, again, has that misconception. So everyone's like, well, one, it can't, he's unlucky, probably won't happen to me. And then the other is, I really don't fancy that test. So you said there's no screening. So is it a blood test? Like where, if I was going to go in tomorrow to my GP, like, a bit like Richard's experience, can you sort of, I'm not saying force the issue, but can you like request it and they can say no? Because I mean, I find that a bit bizarre. If someone's like, I really want to check my health, that you'd get a no, we're doing it unless there's some sort of
I think GPs are becoming more aware now, particularly of these other risk factors like family history, ethnicity, obesity, things of that sort. So if you were to go in at the age of 45 and say, my dad had prostate cancer, I would hope, particularly if you had any symptoms at all, that your GP would offer you a PSA test.
Yeah. And what is a PSA test?
That is the blood test.
So that's a blood test, right?
Yeah. Now, as I've said, the problem with the PSA test is it may only be slightly raised, which may well mean you haven't got prostate cancer at all. But nowadays, the standard thing would be you'd go off, have an MRI scan, have the biopsies and the rest of it, and be told you haven't got it. Yeah. There are other tests out there now, other blood tests that you can do alongside the PSA. So if your PSA is only a little bit up, there's another blood test which is confusingly called a PSE, which will give you a much more accurate picture, and more to the point, it can tell you with nearly 100% certainty you haven't got prostate cancer. Right. And that's always the big thing for me with any test for cancer, is how good is it at saying you haven't got it? Yeah. Because you don't tell people they haven't got cancer when they have. Yeah. If you tell people they have got cancer and you later find out they haven't, all right, that's fairly awful, but it's not as bad as the other way around.
Yeah. Mm-hmm. Yeah.
Is that test available on the NHS, or is it?
At the moment, it's available either if you pay for it or if you've got private health insurance, particularly with Bupa, it's available through Bupa. Yeah. There is a program they're looking at the moment of doing a quick MRI, because as you know, the MRI takes a fair bit of time. And particularly the NHS doesn't have an awful lot of scanners. There's a big trial at the moment to see whether doing a 15-minute MRI test is as good as doing a longer one, in which case they can put more men through it.
Yeah. And so was all your treatment, Richard, through the NHS, or did you leverage PMI?
Yeah, so because my initial tests and diagnosis was done through NHS, obviously when I had it and it knocked me for 6, I thought I'm going to get a couple of other opinions as well. So I did get a couple of consultations through Bupa. Yeah. After speaking to them, and the consultant was like really high up. He was like something to do with the European prostate cancer community or something. He recommended one of the surgeons that was actually in my local hospital. Yeah. So when I knew that it was only around the corner, I ended up having the operation through the NHS, because it was on my doorstep. It was handy, and the aftercare was all kind of done by them as well.
Yeah. I know not everyone is lucky enough to have like private medical insurance, but that is one of like, I think I've only leveraged Bupa once since we've had it in for a number of years, but it is like one that when you do have that opportunity, it's like one definitely to call on. And is it, obviously Tim, you're from Bupa itself, so how does the Bupa work within the sort of prostate cancer arena? Is it a case of like Richard said, it's pointing to specific specialists, or are you doing research? How's it all set up?
Right. So the way it would work, if you're covered by Bupa, you've got two choices. You can If you're able to, you can see your GP, and that's a major issue nowadays, is actually getting to see your GP.
Yeah.
Or you can have a virtual consultation with a GP through Bupa. We've now got this Blue app people have got on their phones, so you can arrange a virtual consultation.
So that's with a Bupa GP, is it?
That's with a Bupa private GP, but it's free of charge. It doesn't come out of your, you don't have to pay anything for it at all. But the other way is you can also go through direct access. So if you've got these symptoms that I mentioned, you can phone up, you can say, I'm worried about prostate cancer, I've got these symptoms. I'll run through a symptom checker, which is approved by NICE. It's all the recognised symptoms. If there's any red flags, as we call them there, you would get referred straight away for consultation, MRI if needed, any other tests if needed. So the whole thing can be done really quickly.
Interesting. And how does it work? So you talked about aftercare as well, Richard. So like obviously you had your sort of your initial request in, which then you got your tests, and then you went through and had the operation. So what was aftercare treatment like?
Yeah, I mean, obviously you get support from the Macmillan nurses, and they would talk to you about kind of rehabilitation, because there's the side effects that are expected. Some of them are unexpected. You can have obviously trouble with your waterworks, where you might need to wear pads for a few weeks afterwards and leaking. There can be other things as well that you probably don't want to go into that affect you downstairs as well, that you get support with. Pumps and medicine to take that helps you get back to normal. But that kind of it's kind of eased off. I'm probably 8-9 months after the op, and I'm pretty much back to normal now. Right. But yeah, the support from Macmillan and the hospital themselves was fantastic.
Yeah. So did you, when you went through Bupa, did you use it for I'm not saying just, but you know what I mean, for that
kind of like you're getting a second opinion, and I think the thing that people don't realise with prostate cancer as well is the treatment can be so nuanced depending on your age and the severity and like so many different factors. You can do probably 20 or 30 different things, and it's trying to work out what's the best course of action for you, depending on how you want it affect you, how you want it to affect your life later on. There's I mean, you probably go through the different treatments, but there's so many different treatments that you can have. But because I was relatively young and fit, they recommended me to have the operation, and then I've got more chance of getting fully rehabbed.
And so what are, I mean, like, I know it's a bit of a tough subject, this one. So what are the different options? Like, so say I'm not quite in Richard's fitness and health. Is there other options that you could be opted into? There
are, as Richard says, loads of options, and they depend on a variety of factors. They depend on the nature and the extent of your cancer. Obviously, if your prostate cancer is just within the prostate gland, there's no evidence that it's gone anywhere else, like the lymph nodes or elsewhere in your body, then basically you're looking at localized treatment. So you can have surgery, which often now is done with a robot. Mm-hmm. You can be in and out of hospital very quickly. They're actually getting better at managing the side effects with the surgery. You can have radiotherapy. Now that can be traditional radiotherapy where you lie on a machine and they fire x-rays at you. That is as effective as surgery at getting rid of localized prostate cancer. They can plant little radioactive seeds in your prostate gland around the cancer. That will shrink it. You can have high intensity ultrasound treatment. That will blast it. You can have it frozen. That will blast it. That's for the localized cancer.
Yeah. And is that, sorry, just to check, so is that everything that's available, whether you're going through the NHS or you're lucky enough to have private access, or is it only if you go private access that you get those?
It would depend choices on where you live to a certain extent. Right. I think the things like the high intensity ultrasound and the freezing it are more likely to be in the big cities, because they're often done by consultants that are really interested in research.
So it is. It's not like a postcode lottery. It's more like where there's high. Yeah. Obviously, we got major hospitals around it in Manchester and Salford, etc. Right.
It's quite new, that though, isn't it?
It is. Some people have reservations about it. They would say if you've got cancer, take the whole thing out. Don't just sap a little bit of it.
Yeah.
But radiotherapy and surgery should be available everywhere.
Yeah.
If it's spread beyond the prostate gland, first treatment is hormone treatment, because Your prostate is governed by testosterone. That's what makes it grow. That's what drives the cancer. So you'd be given hormone injections to block the effect of testosterone. Big side effect of those is basically you go through the menopause, even though you're male.
Yeah.
So you lose muscle, get hot flushes and hot sweats and things. You can still have radiotherapy, but they'll give you radiotherapy to the lymph glands around the prostate as well. You can have chemotherapy if it's spread further. So chemotherapy is another option, and there are new drugs coming on now, new kinds of hormone blockers. There's also a really nice, I like it anyway, I call it a smart bomb therapy, where they've got an antibody that just targets prostate cancer cells, and you stick a bit of radioactive isotope on it, so it takes it straight to the cells wherever they are in your body. It's called lutetium therapy. At the moment, there's a massive row in the prostate cancer community because the NHS won't fund it because they think it's expensive, but that's available through PMI. Right. And that's for, men who previously would have been written off as, it keeps them going for years.
I mean, you talked about like the new things coming online. In terms of it being the most common cancer, are you finding that like in the last 5 years, treatment methodology or options that you've got to go are like progressing quickly because obviously the scale of it, is that where a lot of research?
We were chatting about this before, weren't we? Because I said, is it down to life? Because we've obviously there's a spike in a lot of cancers being diagnosed.
Yeah.
And I was saying to Tim, is this because the treatment and people's awareness is getting better, or is it because of people's lifestyles? And your answer was
a bit of both.
Yeah.
But I think the treatment has changed. I mean, in the 10 years that I've been really interested in prostate cancer, the treatments have changed massively. Even things like radiotherapy now, we're getting very well targeted radiotherapy that could be done in 5 days. Once upon a time, it was 5 weeks or 7 weeks, depending on how bad your cancer was. The chemotherapy is getting better. There are new treatments like, the smart bomb radiation therapy coming in. So the treatment is advancing rapidly. And I think, all the new technologies like genomic testing and things of that sort are also going to change the picture, not just for prostate cancer, but for all cancers. And I think the important thing is that when somebody says they've got terminal prostate cancer, that doesn't mean they're going to die tomorrow. They could still be here in 15 years' time. It just means they're never going to be completely clear of it. And that's I think a really important message now, is that although it's the commonest cause of death in men when it comes to cancer, it's still eminently treatable.
Mm-hmm. Yeah. The reason the decisions about your treatment path as well are difficult. Each treatment that you have, you'll either get side effects straight away or you'll get side effects in 10 or 15 years. Yeah. So depending on your age, they might recommend, say if you're in your 60s or 70s, they might not recommend taking the prostate out because you'll get instant side effects that you might not be able to cope with. Whereas if you have seed therapy or radiotherapy, your side effects won't happen for 10 or 15 years.
And so did that get all explained to you, Richard, like when you're going through this, or was that something?
So that was the reason why I went through Bupa, because it was obviously when you see the NHS, you're on a bit of a limited time with the appointments, and I was a little bit like overwhelmed with it all. So by going through Bupa, I was able to have like a full hour consultation, and did go through every single treatment in more detail, and that kind of helped. But yeah, it's just a little bit of a minefield in terms of trying to make the decision because of how nuanced not only the choice of treatments, but how they can then affect you later on.
Yeah. I mean, I wasn't aware that, like, because when I often think of PMI, I think about it like from a physiotherapy or, broken leg perspective. I wasn't aware that it covered into cancer's a scary word, but it covered into like how when you get into the, much more serious implications. And was that something, were you aware straight away that like from a work perspective, you could leverage that? Or was that something you had to go and
obviously I've been here for quite a bit, so I've used Bupa with like when I've had tummy issues in the past. So I always had it in the back of my mind, if I'm not happy with what the NHS is telling me, I'm going to get a second opinion. Just because of how quick it all happened, and I wanted to spend a bit more time with the consultants. But yeah, they just made it apparent that you've got a lot of choice out there, and they were fantastic as well. But I just made the decision to go down the NHS route because I thought with it being on my doorstep, and if anything went wrong, that you're in the best place.
I get it. So again, I mean, I know you've answered this before, Tim, but just so I get it straight in my head. So if I was worried today, even based on symptoms, so I could either go to my GP, or if I was, because I couldn't get a GP appointment, I could go through our PMI Bupa route, and then I could effectively talk about the symptoms I got, and then that would be a fast track straight in, would it?
Yep. And you're right. I don't think a lot of people do realise that PMI covers cancer, and it's one of the biggest areas for Bupa in terms of the work that we do.
Right.
And all cancers, every cancer, is from diagnosis right the way through. And the thing about PMI is that you're more likely to get treatments that the NHS is umming and ahhing about.
Yeah.
So it's. I think it's, I would say that, wouldn't I? But I think it's really useful.
Yeah.
If
I mean, it's one of the
cancer.
ones where I've always thought really lucky to. I did it my first company, didn't have it my second company. Obviously joined here, and it's something that we all get. But again, it's one where I wouldn't. Now you're talking about it, it's like why wouldn't you leverage it for that?
Mm-hmm.
You know what I mean? Because like you can say is treatments potentially aren't available. You can potentially get access to it, but it's just a bit of one, knowing it's there, because sometimes not everyone knows what you get, and two, I mean, not everyone gets it in terms of like people that tune into this. We've got a lot of employees, but other people some people aren't as lucky enough to get PMI, so it is one where if you have, definitely check your policy.
I think a lot of people just don't know that nobody's going to prompt you to get it checked out.
Yeah.
So I think people need to be made aware that it's pretty much up to you. It's not like cervical cancer or breast cancer where you will be invited to have a test unless you ask for it. It won't happen.
Yeah. So that was a bit that sort of not threw me. That's not the right word, but the fact that you could go, I'm presenting with some symptoms, or I'm worried about this. That actually you can still then go in and get the support for that initial diagnosis.
Yeah.
In my mind, I thought, a bit like yourself, you'd had to get a diagnosis and then you could go, oh, there's a second opinion, or I could get support with the treatment. So it's right from the start.
As long as you've got any symptoms, any signs that you're worried about, you don't have to. I mean, part of the point of having your PMI is to get that diagnosis.
Yeah. So if I wanted to get that PMI and I couldn't get through to the GP, I could then through Bupa get that initial PMI.
Yeah.
It's worth mentioning as well, because when people talk about family history, they automatically think, oh, it's just, are there any men in my family that have had prostate? I didn't realise my mum's family history is brought into account. So because my mum had breast and cervical cancer, that would have put me at a high risk category.
Yeah.
But I didn't know that at the time. Didn't see on the GP.
Yeah.
Yeah,
I didn't know that either. Because it's funny, because like stuff like when you go for your eye tests, if you've any history of glaucoma, it seems like the thing they've always said, and I've always worn glasses, is like anything in your family sort of know it, but because you don't really talk about cancer on a regular basis, so it's a bit where until you know.
So I think it's just historically men are not good at talking about these things. It's like, I mean, but I only have to look back to my dad's generation. I think at least he lost a couple of friends to cancer of kind of the downstairs department, whether it be colon or prostate, because men just don't talk about it.
That's what my granddad died of colon cancer. Didn't get it died. No, he died I think he was late 60s, maybe just no. I think he was, or might have just got to 70. But he was did nothing. He lived up in near Barron-Furness. I remember going to see him in Furness General, but he was he left it so long. It was went in the April, died in the September. It's horrendous.
Shocking.
But yeah, again, in my mind, I go, things have moved on. But then now we're talking about it, it's going, well, when was the last time I even considered, I'll get a niggle in my head and go, might need to go to the GP, and then I'll go, oh, niggle's gone. Don't go. Yeah. And then it's I think someone said last time we went to GP, I'm thinking it's years ago, absolutely years.
It's worth you getting tested.
Yeah, but then I can pick up the phone, not a hesitant, no hesitation, to go, I've got a problem with my car for my bike.
Because it's stopping you cycling.
Yeah. But it is a mind shift change. Are you seeing from stats, Tim, whether it be through Bupa or just generally in the prostate cancer awareness, that are we finding this, that now people are actively seeking it, or is it still a big unknown and it's nowhere near in terms of where it should be?
It's better than it was. It certainly isn't as good as it should be. I think, when there've been a lot of men in the last 2 to 3 years that have spoken up about their prostate cancer, particularly younger men.
Yeah.
So there's a segment of the male population that's aware of it. Then there's another segment that never bothers watching the news.
Yeah.
So, and they don't get to hear about it. As you say, there will be things that go up in gents' toilets and flyers and all the rest of it. But the awareness is getting there. It's not as good as it should. I think it's really good having talks like this. I do talks all the time for Bupa on this and other subjects.
Yeah.
And that's all you can do, is just try and raise people's awareness of it. I think it's really important, though, that we raise the professionals' awareness of it, because, this 50 cutoff is not something you should accept. If you've got symptoms, or you've got a strong family history, or, any other reason why you would be at high risk, you just have to be a little bit more adamant about it. And it's really unfortunate that's the situation at the moment.
Yeah. Because it felt like a few years ago that I do think it seems to have gone in peaks and troughs, because a lot of talk about it went quiet. But maybe that is, like you say, the media outlets or whatever you're looking at.
Yeah.
But no, I agree. I mean, it's one when we started talking about doing a talk on it, it's a bit like, well, it's super personal. But I think at the bit I was more like, oh God, I'll probably have to, like, you know what I mean? As people are telling me these things live, it's like, Jesus, I need to do something.
When you look at the percentages, though, it's quite frightening. I mean, I was just on my calculator this morning. If it's 1 in 8 and we've got 1,000 employees working here, if half of them are men, you're talking about 60, 65 people in the company.
Yeah. Well, I was trying to do, when I sort of did the, like, Autotrader employees, when you described, it's like thinking, oh, that's a lot of
and
us.
it's the percentage is even higher for black and ethnic people. And it can be quite scary when you think of them numbers.
Yeah.
And as you say, it's not a conversation men have. If I go down the pub with my mates, well, we're now of an age where there's a couple of diabetics and one walking with a stick, but you tend not to talk about your health if you can possibly avoid it.
Yeah.
It's worth mentioning as well, it's not just men, it's non-binaries and trans women as well that need to be aware of it, so that anyone that was a woman at birth, a man at birth, needs to bear it in mind as well.
Yeah. Oof. Well, that was usually I say, like, oh, I learned loads, because you do learn loads, but it's like there's loads to think about with that one. Like, loads, especially like you say, now this is where I go, really, am I going to use Bupa this year? Am I going to really use it? I might do for a few physio sessions. It's now when you think about it in the stats, you go, I'm really glad I've got that.
There are
just
simple,
in case I need to
there are little questionnaires. I mean, you mentioned the one on Bupa. There's also one on Prostate Cancer UK.
Yeah.
There's a little survey that you can just complete, and it just tells you whether they think you should have a test or not, or ring your GP. But like Tim said, if you've got a family history or any symptoms that he mentioned, you just got to insist and get a test. Yeah.
Well, cheers for both coming on, obviously from a doctor's perspective and a patient or ex-patient now. Thankfully in remission. Yeah, that's great. Cheers for talking about it, because it obviously is very personal and a very serious topic, which I don't usually cover. Usually I'm like messing about, but cheers for that. So a lot to think about, and hopefully from an audience perspective, the people will go, maybe I need to do something on that. So don't forget to like and subscribe on YouTube and hit the notification button so you never miss an episode, and hopefully you will tune in to another episode. So thanks for that, gents.
Thanks, Pete.
Thank you.
Thanks, Tim.
It's been good.